the fifth, the fourth rib at all. So make sure that you find some ribs, and once you find the ribs, I want you to follow one rib as far as you can follow that rib. So you can see how the orientation of that rib is. Because in patients with COPD, those ribs are going to be elevated. So we need to know what is normal from what it is abnormal. So make sure that you find a rib and you follow it on both sides. I want you to find then in between the ribs, that is called the intercostal spaces. And here we have the intercostal muscles. So if I ask her, and during this time, once I'm there in the intercostal space, do not move your fingers, and you can ask your partner to take a deep breath. Breathe in deeply. What do you think you're gonna feel if you're on the rib? Huh?
Nothing. If you're on the rib, you're not gonna feel anything.
No, you're gonna feel elevation. They're elevating. The ribs are elevated. So you feel you're on the rib, and you can ask her to breathe in, and you see them elevating and expanding to the side, and breathe out, and you see how they collapse. If you're in the space now, they should widen when she breathes in. Breathe in deeply, and even though the ribs are elevating, all of them are elevating, and the spaces are widening. And then when she breathes out, those spaces, you will feel that they collapse. You should be able to feel normally like a finger width. That's what it should be, the intercostal space. And if you breathe in again deeply, now the space is larger, okay? And breathe out. So make sure that you ask your person to take a deep breath so you can actually feel that. And the other thing, and last thing that I want to show you for you guys to find is the transverse processes of C1. Okay? No, you can stay there. You know what? Can you go prone?